It's KMJ at KMJ Now or wherever you stream. Welcome to the Marc Kapetan Show. This is attorney Marc Kapetan, your host. Today's show is brought to you by the Kapetan Brothers Law Firm. We've been serving the Central Valley since 1995. If you or anybody you know has been injured in an auto accident, a truck accident, or a motorcycle accident, give us a call at 559-498-8000. Or if you've been arrested or cited for a criminal offense, call us 559-498-8000. Anytime, Monday through Fridays, Saturdays, Sundays. Call the Kapetan Brothers at 559-498-8000. Kapetan Brothers, we are the Valley's law firm. Hey, folks, I tease my friends that I have the skin of the Greek gods. I'm like an Adonis, right? Marcella, she mentions it all the time. Marcella loves my skin. I have the skin, I say, of a true Greek, not the swarthy Greeks that came over and tried to invade our pure Greek land. But back in ancient times, Greeks would bathe with olive oil. They would apply it to their bodies, and they would scrape it off. That's how they would bathe sometimes when the soldiers were out to war. The Spartans conditioned their hair with olive oil in preparation for battle. And my grandfather would rub olive oil on his knees because he said it lubricated the joints. Now, my next guest may not espouse the benefits of olive oil like my grandfather did, but he is a board-certified doctor of dermatology. He knows all the modern techniques for skincare. He is well-known and well-respected in the Central Valley and was recommended to me by my very own producer, Marcella Taylor, who says he's a wonderful, great guy. Over the next years, he has developed a reputation. Over the years, he's developed a reputation for handling patients with complex medical skin problems such as severe psoriasis, blistering diseases, and autoimmune skin conditions. Other dermatologists refer patients to him and he works closely with major academic medical centers in California. He has authored 10 medical research papers. He stays current with the latest research and treatments for skin disease. As for his own practice, he is committed to providing excellent and compassionate care, he says, for his patients in the Central Valley. So I'd like to welcome to the Marc Kapetan Show from Boswell Dermatology, Dr. Scott Boswell. Welcome, Dr. Boswell.
Thank you, Mark. Thanks for having me.
Hey, I appreciate it. Marcella says you're just the best, just a wonderful guy. All right. Dermatology. We were talking before we started the show. You don't think of it as, you think of it as moles, warts, skin spots, things of that nature. But in your practice, you're known for basically the heavy dutyest of dermatological practices, things that actually save people's lives due to skin problems.
Yeah, that's true. I mean, we certainly see the moles and the acne and the warts, and that's certainly the bread and butter of any dermatology practice. But what I find joy in, what's fun for me, is more the complicated things. That a lot of times that the skin is the window to the soul, so to speak.
Yeah, I love that.
Something else is going on inside, and board-certified dermatologists are trained to know when to run extra tests or to look elsewhere, that the skin is telling you something, that, hey, something's wrong, or that skin disease itself is pretty severe, like you mentioned, psoriasis, severe eczema, and some of these autoimmune diseases that may not be recognized by primary care providers. I think it's sort of a lost art that you say the skin is the window to the soul, and I love that. I think in the past 100 years or so, we've skipped over to where we always thought that testing and medical science and everything was the way to diagnose. And I was just reading an article because I changed my diet about 2 months ago. A lot less red meat, a lot less pastas that convert into sugars and things of that nature. And it's part of what you guys do on a daily basis is you do what we used to do, what maybe an older generation used to do, and say, you just don't look so good, you don't look so well. And it really is not only a window to the soul, but it's a window of maybe how the person's general health is.
right?
Yeah, that can be absolutely true. From the tone that's there, the color of their skin, to certain lesions that we see can be sort of an instigator that, hey, we should look for some kidney problems. We should look for some liver problems. Maybe their triglycerides are too high because they have eruptive xanthomas everywhere, and they're actually in diabetic ketoacidosis, and that shows
an eruptive xanthoma. It sounds like a horror movie. What is that?
That shows up at the dermatologist office sometimes. Absolutely.
In the form of what?
So they get these little flesh-colored bumps, for example, these little yellowish bumps, maybe on their hips, their rear end, and this out of nowhere, and they didn't even know they're a diabetic. And you do send them for some tests urgently, and turns out their triglycerides over 1,000, and they're on their way to pancreatitis and an undiagnosed diabetic. So these are just kind of some fun things that the dermatologist may see. So now all your listeners are going to look at their hips and rear end, and they have eruptive xanthomas going on.
Believe me,
they're diabetic.
I'm definitely a hypochondriac, and as you mentioned that, one of the reasons why I changed my diet was because my glucose was pretty high, and my grandmother had diabetes. And now, remember, Marcel, I was telling you about the little dry spot that I have on my arm right here, where it just sort of seems to itch for the past 2 years, but you hardly see anything but a little tiny skin bump. So looks like I'm setting an appointment now. So oh God, I'll be thinking about that all night long now. What do most people come in for? What's your most common complaint?
So certainly people come in, they've had maybe a family member been recently diagnosed with skin cancer, and they're concerned about a spot on their skin. So certainly, dermatologists are trained to look at the skin and know if that's benign or if it's cancer, if it needs a biopsy or doesn't need a biopsy. They usually want a skin check. Are these moles turning cancerous? Yeah. That's probably one of the most common things, and that's a good thing. People get checked, they're not sure. And, we love primary care physicians. They are the heroes in my book. A lot of times we in medical school get about 2 hours of lectures in dermatology over a 4-year period. So you get the MD degree, you go out and practice, and you go into residency training, and just the MDs then just sort of take different paths, whether you're OBGYN, general surgery, dermatology. So a 3-year dermatology residency really trains you to have an eye for what is important, what's not important. And like I said, the primary care physicians are wonderful, but just have a different and less trained eye from what we're supposed to be able to see. So, so that makes it fun because, in medical school, they teach you what 70% of the diagnosis is in the history. So that's why your primary care doctor asks you questions of where does it hurt, where does it radiate to, how long has it been going on. Dermatologists don't care so much about that. We look at it, we see that most of the diagnosis is not what we ask you, but what we see on your skin.
Do you have this thing, I always tell people, I get a police report when a client comes walking in, and literally it could be a 20-page report, and I could skim it for about 30 seconds and know exactly what it's all about. And go on a half-hour-long dissertation to the client. Do you have that thing where you see the person's, and as soon as they walk in, you go, I'm going to check this out?
They'll say, hey, this. You ask, hey, the spot on your nose. They say, oh yeah, that's a pimple. It's been there about a week. We say, no. And in my mind, I said, that's a basal cell carcinoma. That's probably been there a year without you knowing. And so we believe what we see more than what they say, and that's to protect the patient. I mean, certainly we certainly rely upon the patient telling us a history, but again, dermatologists are trained to kind of know what this is and to go forward with that.
So for the person that doesn't go to the doctor all the time, which they should, or the person that's just at home and goes to the doctor, what should we be looking at when we get with my old body now, when I get out of the shower and I stand in front of that mirror, I used to look at this I like to say the Greek god, right? No, I look at this old man. What should I be looking at?
So in general, there's some rare types of skin cancer, but the 3 most common types of skin cancer are, number 1, melanoma, which is the most serious form of skin cancer. And that's usually, not always, it can be pink or red, but usually a very dark, flat area, mole on the skin that's getting funny borders or changing, not necessarily elevated and raised up, but just getting funny borders as a flat mole. Those are the high-risk ones. And so we look for that. The more common types of skin cancer include basal cell carcinoma, which kind of everybody gets one, and another one called squamous cell carcinoma. Those look like pimples that won't go away, like a shiny pimply bump, might be scabbing. You thought it healed up, but wait a minute, it's been 2 months now. It's breaking out in the exact same spot there on my shoulder.
Coming back, right.
Keeps kind of festering, and people just think it's a sore, but that's a little skin cancer called a basal cell or squamous cell carcinoma. easily treatable in any dermatologist
That's what I understand.
office.
Is that either cryo or blue light therapy or something like that?
No, those are more the precancers. Those are more for what are called actinic keratoses, which are kind of these precancerous spots that maybe have a 5 or 10% chance of turning into squamous cell carcinoma.
Yeah.
But those are kind of cryotherapy. Blue light is used for that. So the skin cancers usually get biopsied and most often surgically taken care of.
We are on with Dr. Scott Boswell from Boswell Dermatology. We'll be right back after this. This is the Marc Kapetan Show on KMJ. It's KMJ at KMJnow.com or wherever you stream. Welcome back to the Marc Kapetan Show. Folks, hey, we're looking for a sponsor. Yes, right, Marcella? We're looking for a sponsor. Yes, wait. Ready, Marcella? Are we looking for a sponsor? Yes. Marcella says, call us if you'd like to sponsor the Marc Kapetan Show. Hey, I'll tell you what, there's a nice little package that we've put together of commercials throughout the week and some promos and stuff, and also the promos that we do here on the Marc Kapetan Show. So if you're wanting to sponsor the Marc Kapetan Show, we would love to have you. Call Marcella at 559-498-8000. Marcella at 559-498-8000. The wonderful Marcella. She also yells at me to share, like us, subscribe to us on YouTube, Facebook, Truth, Rumble. Kapetan Brothers Law Firm, Kapetan Brothers, Marc Kapetan Show. Find us on any one of those things. Also find Dr. Scott Boswell. Hey, Dr. Scott Boswell. It's not Dr. Scott Boswell. It is Dr. J. Scott Boswell. What's the J for?
So my parents did it to me. So it's John Scott Boswell, but I'm named after my uncle who passed away as a kid. And so my dad always thought when I have a son, my uncle went by Scotty from my grandparents. And so I have no problem with John. It's just that my parents had me go by Scott like my uncle did when he was a kid.
Oh, that's sweet.
So I went by Scott or Scotty growing up, although my dad's nickname for me is Scooter.
Scooter?
So I might answer to Scooter sometimes.
Call Dr. Scooter for all your dermatological needs. I love that. That's great. Okay, listen. I want to talk about family, but the cancer thing is so important to me just because of family members who have had it and friends who have had it. I tease a lot of my quote-unquote Caucasian white friends about the problems that they have with their skin. But and I also did joke around about me being full-blooded Greek, etc. But my grandmother had, and my grandfather, great skin. I mean, just beautiful skin until they were 80s. My grandfather lived to 97. He had great skin. Is there a difference? Is it true that the British people and stuff are going to have worse skin? I know you're British yourself, but you got beautiful skin. Is there something about that? And is there something that they should be doing or all of us should be doing to try to prevent all those problems with cancer, et cetera?
So certainly having more pigment in your skin protects you from skin cancer. We know that. So, Caucasians certainly higher risk for that. And so we live in the Central Valley where we have a lot of Caucasian farmers, for example, who get tons of sun, where, skin of color is probably more protected from the sun for sure, and including skin cancer.
Yeah.
The studies have shown that the main risk factor for skin cancer is actually childhood, adolescent, and young adult sunburns. So I tell my patients, avoid the burns. Of course, don't be a hermit. You need to be outside. You need to be in the sun. You need to have a life and have fun. But really protect yourself by protecting you from the burns. And so sunscreen, especially what's called the physical blockers, right? So the zinc oxide, titanium dioxide, those are the kind of ingredients that dermatologists prefer patients to use for sun protection because they don't get used up. A lot of the chemical blockers like avobenzone, oxybenzone, you might read on the back of that sunscreen, they tend to absorb the UV radiation, they undergo a chemical change, and then they're used up within an hour or two because that UV radiation made that chemical different. So they get used up, which is why you still burn after you put the sunscreen on. So preferable is the zinc oxide, titanium dioxide type sunscreens that don't get used up.
But that is the one that it basically shows up white on you, right?
Not necessarily. I mean, you think of back in the day, Zinca, right? With the lifeguard with the blue nose. So there's some companies now that have micronized that zinc oxide, and so you can find products, and they're at the store, where it doesn't leave that white pasty residue on your face. And so those are the preferred sunscreens. And so avoid the burns.
And they've literally traced it back to, I think, the burns.
Yeah. So certainly there's a role for cumulative sun exposure over time. But for example, basal cell carcinoma, which we were talking about earlier, the main risk factor is really childhood, adolescent, young adulthood sunburn. So when a patient comes to me and they're in their 70s and 80s, they say, "What do you mean I have skin cancer on my back? That hasn't seen the light of day for a long time." I say, "I know, but this is from a sunburn back when you were at the beach in LA growing up. This is why you have this."
Okay, I have a couple people in the office. One, red hair, white skin, freckles. Other one, red hair, especially if they have shaved heads or bald heads or whatever, stuff like that. Not talking about anybody in particular, by the way. He's going to kill me. Young lady with freckles, red hair, young man with freckles, red hair. Should they always be doing checkups with their regular doctors, but also with a dermatologist? Should they? Some of the procedures I've seen, or the treatments, Effudex. Some of my friends, sister-in-law, etc., Effudex every couple of years, to make sure to kill the precancerous cells.
Yeah, so Effudex or fluorouracil, a lot of dermatologists prescribe that in the fall and winter, but that's really only going to work if you have diagnosed what are called actinic keratoses, or AKs, if you want to sound cool.
Okay.
So these precancers, or if you get one or two, the dermatologist might freeze that and get rid of it. But if you have like a dozen, the dermatologist is going to ask you, "Hey, you should go through this cream," and there's several like Effudex or fluorouracil to go through to kill a bunch at once, usually during the winter months, because those creams make you pretty sun sensitive. So we prefer to do it foggy, rainy, cold weather.
Is there a thing, I've heard with, I had a history of prostate cancer in my family. They said basically, if you have a history, 1 out of 3 of you will get it. If you don't have a history, 1 out of 9 men will get it, and all men will get it eventually by the time they, before they pass. I mean, you'll either die of it or you have it before you die. Same thing with skin cancer is pretty much most people going to get it at some point in their life, or at least have something that it may not kill them. It may not be something they ever treat. But is it something that all people have to be aware of?
So yes and no. I mean, there's things called Fitzpatrick skin types is what dermatologists sort, and that's your tendency to burn, right?
Yeah, the redheads, right?
So the redheads. So I may be, instead of salt and pepper, I'm going to more cinnamon sugar these days, but I was a redhead.
That's a good way of saying it, yeah.
And so I'm probably a Fitzpatrick type 1, where it's kind of fair skin. I'm going to burn. I'm not going to tan. And that goes up to 1, 2, 3, 4, 5. So different Fitzpatrick skin types have different risks for burning and skin cancer. Yeah. So the darker your skin, the higher your Fitzpatrick skin type. That being said, even patients with skin of color, for example, they are at higher risk for melanoma on their feet. So we all know the story of Bob Marley. That's a movie right now. They're all excited about the Bob Marley movie, but he died of melanoma.
I didn't know that.
On his foot, on his toe. So I tell my skin of color patients, hey, statistically, Caucasian, maybe melanoma is most common on the trunk, whereas skin of color patients, be sure to check your feet.
Okay, wait a minute now. On his toe, are we talking about, is it typically lighter skin on the toe that caused it? No. Or is it just...
So melanoma is not all about sun exposure. Certainly sun exposure is a risk factor for melanoma, but there's genetics and things like that where melanoma can pop up on the bottom of your foot. And so I tell my patients, hey, once a month after the shower, take a look at the bottom of your feet and between your toes. Make sure no dark spot is popping up. Now, that could still be a benign mole. Doesn't mean all dark spots are melanoma, but not everything is about the sun. So you can get an 89-year-old, Caucasian farmer with a melanoma on his left cheek from driving all those. Okay, that is sun exposure.
Right.
You get a 21-year-old female with a melanoma maybe on the back of her leg. Okay, maybe she had some sun exposure growing up, but come on, she's 21. So there's certainly some genetics there, and we see melanoma genetically in families.
But does it metastasize into the rest of the body? Is that what happens? How does a small spot on your foot become something so deadly to the rest of the body? Don't you just cut it out or cut off the foot?
So great. So again, not all skin cancer is the same. The reason melanoma is so deadly is it has the tendency, as it starts in the first layer of skin called the epidermis, but as it goes undiagnosed and grows, it finds the dermis, the second layer of skin, and then it finds the blood vessels and the lymphatics. And so melanoma has a tendency to hitch a ride on those lymphatics or the blood vessels to the lymph nodes, or heaven forbid, throughout the body. And so that's why, really, particularly with melanoma, early detection is key. So if you have an early melanoma, for example, called a melanoma in situ, which is only in the first layer of skin, cut it out, you're good. If you have a melanoma of a certain depth, then all of a sudden you need to go to the surgeon to get your lymph nodes looked at, and the conversation gets a little bit more dicey.
All right, listen, check your feet. Check between the toes. Check in the mirror, check your back, check all that stuff. Oh, boy. All right, we'll be right back with Dr. Scott Boswell from Boswell Dermatology right after this. This is the Marc Kapetan Show on KMJ. It's News Talk 580, 105.9 KMJ. Welcome back to the Marc Kapetan Show. Folks, you know the drill. If you've been arrested or cited for a criminal offense, or if you've been injured in an auto accident, a truck accident, or a motorcycle accident, who do you call, Marcella?
The Kapetan brothers.
The Kapetan brothers. Not quite as dramatic as she normally is, but... Folks, I'm serious. Listen, I'll pot this music down. If you have been in an accident, it is the scariest of times. We were just talking about with Dr. Boswell about going to the doctor with unknown problems that you have. It's scary. You don't know what to say. Sometimes you can't talk. Like I said, I couldn't talk. One of the times I went to a doctor, I was so scared of something. But listen, I've done this for 32 years. My brother Peter's done it for 35 years. We know what we're doing. We really do. And we have answers that you may not even think of. And it's just like reading skin cancer on a face. It's very easy for us to know what the right answers are and what to do. We'll ease your concerns. We'll ease your mind. We'll represent you if we think you have a case. And it's just a phone call that you have to make. And why sit there and worry about it? Just make the phone call, go set up your appointment, and come in and talk to us. Kapetan Brothers, 559-498-8000. We are on with Dr. J. Scott Boswell, John Scott Boswell. I'm going to call you, what is it again, Scooter? Dr. Scooter Boswell. He's with the Boswell Dermatology practice. By the way, you're going to hate that because now all your personnel over there are going to start referring to you as Scooter. You got into Marcella says you have a wonderful story about how you got into dermatology. Tell me about it.
So, I'm the only physician in my family. So my dad's an attorney.
Yeah.
I'm a Fresno native, and when I was 12 years old, so I went to Faulkner Elementary, and then Tenaya, and then Bullard High School.
Where you got your BMW, right?
Yeah, no.
No BMW at BMW?
I drove a Honda.
Okay.
Anyway, but when I was 12 years old in 6th grade going to Faulkner, one weekend I got a kind of a high fever and a sore throat and got really sick, and my parents were concerned and called the pediatrician, and he called in some antibiotics. I still remember I was at a Fresno State football game, just kind of feeling miserable, spending the night at a friend's house on a Saturday night. So anyway, my parents came and picked me up because I was sick. Pediatrician called something in, and within the next few days, started getting a rash, started getting swollen lips, and a fever about 105, 106. What is going on, right?
Yeah.
So went to the pediatrician. They couldn't start an IV. I was dehydrated. They rushed me to the Old Valley Children's Hospital.
That's right.
On Shields.
Yeah.
So this is back in the day. And I was, eventually it all showed up as a very rare 1 in a million rash called Stevens-Johnson syndrome. So your listeners can Google that. Stevens-Johnson syndrome can be caused by a medication, but is a very severe rash that can also be caused by the infection that I had itself. I know that kind of sounds funny. And so I was hospitalized for about a week as a 12-year-old boy there at Valley Children's Hospital.
Who had just spent the night at a friend's house, and Dad's wondering what the hell you guys did.
With the doctors saying words like Stevens and Johnson. Who's Stevens and who's Johnson?
Right,
why? Who are these punks? Like, why am I in the hospital because of them, right? And so nobody really knew what was wrong with me. And actually, it was an ophthalmologist, a pediatric ophthalmologist here in town, Dr. Andrea Lanier, who a lot of people know.
Fogg, Maxwell, and Lanier.
Right. So she came in, and she kind of, from my eyes, diagnosed Stevens-Johnson syndrome. So I was diagnosed with that. And from that experience, being hospitalized and very sick, the rash got better. I survived. My parents were being told that I had a 10 30% chance of dying, and kind of a scary time.
Oh, it was that significant?
It was a very severe rash. So if you look at internet photos of Stevens-Johnson syndrome, these are people that go to the ICU in the burn unit.
Oh my God.
Intubated, and it can get kind of out of hand as the skin basically peels off and your lips peel off. And it was a sad time. All the while, my friends at Faulkner in 6th grade, of course, spreading the rumor that I had herpes, which is why I was in the hospital. You know, these 6th graders don't even know what herpes is, right? Anyway, but I missed 6th grade graduation and survived Stevens-Johnson syndrome. So from that episode, I grew up then through junior high school. And what I want to do for a living? Well, I want to figure out and help people with severe skin disease.
Right.
So sort of this lemonade out of lemon story of where I wanted to help people with what I had gone through as a 12-year-old boy, and the doctors that helped me get through that.
Well, what's funny is that the bio basically says that your focus is not just on dermatological, conditions and treatments and stuff, but you just thrive on that really, really significant, serious stuff, and it's because it happened to you.
Right. And so I think most people think of a dermatologist as, warts, moles, acne, and that's fine, and cosmetics and Botox, that's all great. But my particular interest is really helping people with medical dermatology, more severe skin disease. That's why I went to medical school.
Yeah, and disappointed dad who was a lawyer, right?
Yeah.
Believe me, I was at Fresno State. I was going to do pre-med, and I was taking the biology classes, and then I had to take chemistry. And I did organic and not inorganic chemistry. And like after the 3rd semester of chemistry, I go, how many semesters of chemistry do you have to do? They go 7. I go,
keep going, yeah.
I switched. I said, I'm going to do environmental biology. And then I just went into law school. Yeah. A good Bullard boy, right?
Yeah.
Good Mormon boy.
I grew up at Bullard playing volleyball. Yeah. My son's playing volleyball now. So, I am a local Northwest Fresno kid.
What temple did you go to here in town?
So there's the Fresno Temple. I attend church sort of near the Fig Garden Loop in Sierra. Yeah. So,
do you know I was on the Mormon basketball team? Look at me, 5'6", right? Mormon basketball team with Greg Lemon, who brought me in to the basketball team there. I'm not Mormon, but we used to practice at the gym over at near Fresno State, the temple over there.
Yeah, the church there near on Cedar. So we usually call it church basketball. It's the only fight that begins with a prayer.
Yeah. Yeah. Believe me, there was fighting too. Yeah. Yes. Oh, too funny.
A lot of testosterone on that basketball court sometimes.
That's too funny. Did you do a mission?
I did.
Where'd you do your mission?
So I served my mission. If you can think about this, I was assigned to Salt Lake City, Utah.
Oh, come on.
So that's what you get being from Fresno, California. Is Salt Lake City, speaking Utah.
Yeah, exactly. That was the language you learned. That's not fun.
But we believe it's an inspired process. We go where we're assigned. My wife and I have 5 kids, and our oldest went to Germany. Our second oldest she went to St. George, Utah. So it just depends. So I have one daughter that's fluent in German, and she went to Berlin.
Yeah.
So she's now married with a kid, and
good for her.
Yeah. So
really, But you have 5 kids, right?
We have 5.
The rest haven't gone on their missions yet, or?
So we've got 3 out of the house. We've got one married with a kid, and she and her husband live in Manhattan, Kansas, in grad school. So that's the little apple there in Kansas. And then we've got 2 girls at BYU in Provo, Utah, and then we've got a 16-year-old son here that goes to Bullard and plays volleyball like I used to do. Good. Has the same coach, Roy Verduzco, that I had growing up. So
I know I've heard of Coach Verduzco over there.
He was my volleyball coach. Now I see him getting after my son for the same things that I did on the court when I was that age. And then we have a 12-year-old daughter, Abby.
How did the good Mormon boy do over at Tulane University in the middle of New Orleans?
Yeah, so graduating from BYU, going to Tulane Medical School is sort of like going from Chuck E. Cheese to the drag queen show. But absolutely. I'll tell you, Tulane's graduation was a lot of fun, though. It was not much different than BYU's graduation. But I had a great experience. We love New Orleans. Tulane treated us so well. I just had such a great experience in medical school, and we love that. It's a special season of our lives. We had 2 kids born in New Orleans in medical school. So.
And then eventually over to University of Texas. You were the chief resident over there.
So I did a 1-year intern year back here in Fresno at UMC back in the day. That was in 2005. And then I did my dermatology residency after that at University of Texas Southwestern Medical Center in Dallas.
Good for you. Sharp guy. Yeah. Okay, last question for this 3rd segment. You're a fan of ice cream. Ampersand ice cream?
Yes, I think the portions are too small, but it's good.
Just order a double scoop.
I like quality and quantity. That's my downfall.
The best chocolate sorbet I've ever had, right?
All right. Yeah, it is pretty good.
What do you like? What's your go-to?
Anything chunky. I think vanilla is boring. I would rather not have ice cream. If you're just going to give me vanilla, I want something else.
Ben and Jerry's is for him. There you go.
That's right. Chunky Monkey.
We'll be right back with the Chunky Monkey, Scooter Boswell from Boswell Dermatology. It's News Talk 580 1059 KMJ. Welcome back to the show. Hey, KMJ or KMJnow.com, wherever you stream. Catch us. We are streaming nowadays. But we also like you to go to the Marc Kapetan Show on YouTube. MarcKapetan. No one knows how to spell that, Marcella. We need a better show title. No? You want to keep the Marc Kapetan Show? Marcella says we have to keep the Marc Kapetan Show. Okay. Spell the name right, folks. Kapetan. Go to Marc Kapetan Show on YouTube, on Facebook, on Rumble, on Truth, all the major sites. So, and catch us streaming. We do the show. It's videotape. You get to see the very, very handsome Dr. Scott Boswell, Scooter, as we like to know him now. You're what, 49? You got great skin too, man.
Yeah, I'm 48.
48.
Yeah.
So, yeah, great skin. Very handsome gentleman. So, hey, an Eagle Scout.
Yeah.
And a piano player. Do you ever do pop stuff or is it all classical stuff?
Oh no, I was raised in the time before Spotify where you had to sit there, wait for the DJ to play your song, hit play record at the same time, and the DJ would talk over your favorite song during the intro or whatever. So I grew up trying to figure out Van Halen and
you had to slow down the record a little if it didn't tune in just quite right. Yeah,
I had to. So I learned the old school way, no YouTube videos.
That's right. Wait a minute. That's right. You were talking about you love Dream Theater. Do you do that kind of keyboard stuff?
A little bit. So the progressive rock. I love Rush. I love Dream Theater. So some of the stuff's a little heavy, but I really love the progressive rock where it's sort of changing time signatures.
Okay,
and like
check it out. So not this Saturday, but next Saturday, Fulton 55 calls me up. I do a Cheap Trick tribute. And they said, hey, we need an opening act. I go, great, I'll come out and I'll do it. Who are we opening up for? Opening for a Rush tribute.
Is that right?
You could be my guest. Bring the wife or don't bring the wife. Because I said
Rush too,
she likes Rush too. Mm-hmm. Okay, good. Because you said she doesn't like Dream Theater, right?
Passed away, so she's not a Dream Theater fan, but we like Rush.
Yeah, bring the wife and you could be my guest. Okay.
Cool.
All right. So and we talked about Dream Theater. I was on a ship with those guys. One of the rock and roll tours. I don't know what I do on those things. It's nuts. Okay. I know this is plastic surgery and thing isn't what you do. There's a difference between plastic surgery and dermatology, et cetera. But what are it's gotten out of control, right? I mean, it's just nuts. Do you have people coming in and you sit there and you just go, geez, what did you do to yourself? And I don't want you to talk specifically, but as a general thing, it needs to stop. There's a lot of beauty things that you could do for beauty that are dermatologically related and not plastic surgery related, right?
Sure, and there's some simple things you can do if you want to improve appearance a little bit of things that bug you. So we always ask people, what bothers you? And tapering those things and not upselling everybody, but just like what bothers you. There's some simple and even less, not very expensive things that you can do to improve the appearance of your skin. But I often even talk people out of it, saying, I think you look great just how you are. So
there is a lost art, or there's a lost sense of self that's out there. I used to love like Sophia Loren and Katharine Hepburn and all these actresses that they aged and they got their wrinkles and all that kind of stuff, but they were still beautiful because number one, you remembered the way they looked and they still had the same smile, the same eyes, the same character. They were funny, etc. And it goes a long way compared to distorting your face.
Yeah, and we don't get into the heavy stuff, like you said. The plastic surgeons are doing stuff, but there's some simple things that people appreciate. That I don't think Botox is a huge deal, for example.
Right.
I don't think that some of the things that we do, a lot of dermatologists do in town, can be very helpful. But you're right; it's important not to overdo it. You are still you and beautiful.
It's funny that you say that because I was watching the latest Botox commercials, and they have the lady on there, and listen, I think it's great, and But like you said, if you say, I want X amount done, the doctor should cut it in half, cut it in quarters or whatever, because she says, look I don't have the wrinkles I had before. But then, you know, at some point, she doesn't have the sparkle in the eye that she had before, in the sense of sometimes could be overdone even with that too.
Sure. We have those realistic conversations and with patients, and people are usually pretty reasonable.
Okay.
They just want something sort of help sometimes.
Do you have a regimen yourself as far as facial care? Facial scrubs, facial wash? I mean, obviously washing your face every day is good, not overdoing it, but creams, things of that nature?
So I'm a dermatologist, but I'm also a guy. So
you know what? I love that.
I don't know. I take a shower. I use some moisturizing lotion and some sunscreen in the morning, but listen, I don't have some 7-point protocol of what I do.
Okay. My mom always said use Clinique, because she loved Clinique as hypoallergenic. I squirt a little bit of I put a little bit of that on and squirt a little aftershave, and I say that's it. That's my whole regimen. Nothing in my hair, no creams, no nothing. So I appreciate the fact that you say that. I love this quote from one of your patients. Not only a great doctor, but a great patient educator. I appreciate his patience and kindness. It's good to educate people when you have them in there. It's not just a matter of treating them. It's that great bedside manner.
So to me, that's the fun of it, right? Because in my opinion, sometimes we as physicians get into the medical mumbo jumbo, and that's not helpful. Or even worse, sometimes I'm the doctor. Trust me, this is how it is, and no patient wants to hear that, right? So most patients just want to know what's going on with their body. In my case, what's going on with their skin, why it's happening, what it's not. So sort of the Dr. Boswell formula, and I teach this to the nurse practitioners who work at my office, is we teach them what it's not, what it is, what we're going to do about it to get them better, and what are some options if it doesn't get better. So they leave with some hope.
Yeah.
And so that's sort of the Dr. Boswell formula to clarify that no, your eczema is not due to your gluten or to your laundry soap. This is actually an autoimmune process of atopic dermatitis. This is what it causes it, and this is what I recommend is done, and this is why, because here's what eczema is, and this is the medicine that treats that eczema. And if that doesn't work, we got this in the future.
It's got to be wonderful to be doing the job, because it's life-changing. I'm dealing with difficult problems, and I may make it a little bit better because the charges may get reduced. We may ease their suffering by getting them some money but they're still in that same position where it doesn't change their life in the sense of they're always going to have either the stigma of a criminal conviction if we can't get them off, or they're always going to have residual pain from the injuries that they received. And so our wins are sort of bittersweet. Some of your life-changing things, like I watch these Skyrizi commercials with the people with plaque psoriasis and stuff like that. I want to cry when I see the commercials, because you see these people now 10 years later, Cyndi Lauper and all these things, and they're life-changing things that you are treating them for, that you're doing to treat them.
Absolutely. So take psoriasis, for example. You brought up some psoriasis medicines, and there's doctors use the word comorbidities. In other words, there's other diseases and conditions, depression, anxiety, heart disease, that are elevated when people have psoriasis. And so dermatologists come at that with these medicines that we use for psoriasis, for example. And when you can clear their psoriasis, the studies show that your risk of heart disease goes down, the risk of depression decreases, and all these comorbidities of other stuff you have going on in your life can really be helped by clearing your skin.
Really?
And so it's wonderful. So these patients, their lives are changing. Or for severe acne, that kid, you clear up his acne, and for the first time he's looking in your face instead of looking at the floor.
That's the greatest one. I got to say, one of my nephews had to go through it with the treatment. I know it can be painful in the sense that it dries out the skin a lot, and it's a long process, but I quit eating sugars at 12 because I didn't want to get acne, and it lasted for 10 years. I didn't eat sugar or fried foods or anything like that, but it's just a life-changing thing, because in high school, like you said, when you were in high school and kids teasing you with the rashes, that's one thing that these kids don't have to suffer anymore.
And that's what's fun about dermatology is people usually get better, right? We can't get everybody better. No doctor's perfect, including myself. But certainly it's so rewarding to see these patients improve and feel and look better.
Yeah, I got to say, it was very, very enlightening, very interesting talking to you, Doctor. So, Dr. Scott Boswell, I almost called you Scooter again. Dr. Scott Boswell from Boswell Dermatology. I loved it. Thank you for being on the show.
Thanks
I appreciate it.
Mark.
Yeah, we'll see you next week on the Marc Kapetan Show. Thanks to my wonderful producer, Marcella Taylor, for all her years of service. No, for all her years of friendship. And thanks to all of you out there. We'll see you next week on the Marc Kapetan Show. This is KMJ.